is Max Kellemen. This is Nate Howard. We just got off a policy panel at our Portland Psychedelic Symposium here, and we are unveiling a new ballot measure that's being spearheaded by the Plant Medicine Healing Alliance, Portland Psychedelic Society, among Sacred Garden, among many other stakeholders that we've engaged in this process. A lot of people think this is a done deal. Psilocybin is legal. We're in this market, but those who are engaged with this work understand the limitations of the regulated model, primarily access and education around this for a lot of folks who are not going to be able to afford the regulated model. So let's just jump off that point of like the why now and why a decrim bill.
So the ballot measure we've proposed, the Portland Psychedelic Health Act, which would be a Portland measure voted on in the general election as currently planned in 2026. What does it do? Well, it creates clarity for the public and for our partners in law enforcement that naturally occurring psychedelics, and there's a lot of them, are the least enforcement priority. Measure 110, the broad-based decrim in Oregon, was partially rolled back or rejiggered, and we passed Measure 110 at the same time that we passed Measure 109, a state-regulated access program focusing on safety and education, publicly available for psychedelics, focusing initially at least, as it still is, on psilocybin. And before we get to why we need this measure, we needed those two measures because we knew that the American public was not in trouble from these things that, excuse my language, 53 years later are still Schedule 1, no medical value. They knew it wasn't because it wasn't safe, but because it allowed them to, quote, control black folks and hippies better, and it allowed for their other policy goals. Somehow, we have not brought these back from Schedule 1, which means no medical value, despite the federal government having funded university-led research showing that many of these things, including psilocybin, LSD, MDMA, among others, the things that we are looking to protect in Portland and create a thriving community around, they are frequently, from IRB-approved research, sometimes with federal grants, shown to be the most effective treatment for treatment-resistant depression, major depressive disorder, treatment-resistant anxiety, PTSD. And so Oregon has done a lot of cool stuff. We created the ballot measure process, which swept the nation, created that in response to a non-responsive legislature. We decriminalized cannabis for the first time with Measure 109 and 110. And the work before that, we are helping create a template that will hopefully proliferate and be adjusted when we get it wrong, and we get stuff wrong state by state, city by city. And at some point, I'm interested in a conversation around restorative justice from the United States' role in the UN, seeing as we exported the war on drugs and the underpinnings of a carceral state that has now swept the globe. And so in Portland and Oregon, we're doing some good work, and the policy picture is not complete. The latest iteration of what will hopefully be a gold standard of prioritizing compassion and science around drug policy and psychedelic medicine and recreation is embodied in the Natural Medicine Health Act that the Portland Psychedelic Society is now leading. And it is to clarify for the public, for law enforcement, some drugs, when consumed and grown and shared with reverence and understanding, can be some of the most powerful medicine in the world. There is nuance that is lost in an all-out war on drugs. And when that nuance is lost, public health outcomes get worse. And so this is to support the public, the law enforcement, create education through the establishment of a City of Portland Psychedelic Advisory Commission made up of experts appointed by City Council.
There are still people whose lives are affected by cannabis, which is now a massive industry across the United States, and they're still serving time, or their lives are still destroyed by a dried plant.
200,000 arrests related to cannabis last year, I believe.
Exactly. So it's like when we're engaged in these movements and these reforms, it's easy to feel like we're getting ahead of ourselves and things feel settled, but we still have so much further to go. And then this decrim bill just feels like first step of many to get us where we really need to be. And when I see people who are working in what we call the underground or the self-regulated communities, they're still, when you force things into the darkness or into the underground, if we can decriminalize, we can allow others who perhaps wouldn't even take those risks to enter the conversation at the very least.
Don't have the privilege to take those risks.
Exactly.
Yeah.
And so that's I'm okay with the baby steps, because when we throw Hail Marys, sometimes we can't catch the ball, so sometimes we have to.
Or it sparks a backlash, and it regresses. Yeah.
So I love the coalition and the approach that we're doing here. Like I said, this is just going to be one of many conversations we're going to be having with each other, but with the community, and I want to expand the circles in which we can reach. And there's so many people that need to be a part of this conversation who this is going to be a new topic for them, and they deserve to have a voice in too, and their curiosity is going to help us inform the work that we do. So I really appreciate you taking time to share some history, why you're involved with this, and I look forward to working with you more.
I love the idea of additional stakeholders, why this is helpful to the general public who have no interest in psychedelics, why this is helpful to law enforcement, the city, and the state. This is part of a broader conversation around increasing public safety and public health on all levels. And on the face of it, you would not see that. And so this is going to be essential. Yeah, thank you.